Obstructive sleep apnea. OSA is one of the most common, yet frequently underdiagnosed sleep disorders. In this video, a board-certified sleep specialist introduces the fundamentals of OSA, from its underlying physiological mechanisms to the serious health consequences it can cause. OSA occurs when the upper airway repeatedly collapses during sleep, obstructing the flow of oxygen to the lungs. As a result, the brain is forced to wake the body momentarily to reopen the airway, leading to severe sleep fragmentation, often without the patient even realizing it. These brief apneic episodes may occur dozens or even hundreds of times per night. Patients with OSA are at significantly increased risk for cardiovascular complications, such as hypertension, arrhythmias, heart failure, and stroke. Chronic oxygen deprivation can also impair memory, reduce attention span, and diminish overall quality of life. What makes OSA particularly dangerous is its silent nature. It often presents without dramatic symptoms, making it easy to ignore. That's why OSA is considered a low-hanging fruit in health optimization. Once detected and treated appropriately, it offers tremendous potential for improving general well-being and reducing cardiovascular mortality. OSA is a sleep-related breathing disorder characterized by recurrent episodes of upper airway obstruction during sleep, leading to reduced or completely halted airflow. During sleep, the muscles of the pharyngeal region relax, causing the tongue and soft tissues to collapse backward, obstructing the airway. This results in decreased blood oxygen levels, prompting the brain to awaken the body to restore airflow. Such cycles can repeat dozens to hundreds of times per night, disrupting deep sleep and leading to various health consequences. A notable case is Joanne, 59, who was once a sound sleeper, but began experiencing difficulties after jaw surgery. She reported, "I woke up in the middle of the night at least 8 times each night and felt absolutely exhausted throughout the day." Chronic hypoxia and fragmented sleep not only diminish quality of life, but also elevate the risk of cardiovascular diseases, hypertension, arrhythmias, and stroke. Therefore, timely recognition and treatment of OSA are crucial for safeguarding overall health. Obstructive sleep apnea. OSA often goes undiagnosed for years because it occurs silently during sleep. However, there are hallmark symptoms that can help identify the condition: chronic loud snoring, sudden awakenings accompanied by gasping or choking, morning headaches, dry mouth upon waking, excessive daytime sleepiness, and reduced concentration. Importantly, patients are often unaware of their own symptoms. Instead, signs are frequently noticed by a bed partner. Mrs. Linda, 67 years old, shared, "My husband said I stopped breathing dozens of times every night. At first, I didn't believe him until I started nodding off while watching TV or driving." In addition to core symptoms, OSA may manifest indirectly through depression, irritability, memory problems, and insomnia. Among older adults, symptoms may be subtler and often mistaken for normal aging, such as persistent fatigue or reduced motivation. Early detection through symptom recognition and confirmation via polysomnography can ensure appropriate treatment and significantly improve quality of life. Consequences of untreated OSA. Obstructive sleep apnea may seem harmless, but when left untreated, it can lead to devastating and even life-threatening consequences. Repeated drops in blood oxygen levels during sleep activate the sympathetic nervous system, resulting in chronic hypertension, heart arrhythmias, stroke, and heart failure. Studies have shown that individuals with untreated OSA face double the risk of death compared to those without the condition. Beyond cardiovascular damage, patients are more likely to experience cognitive decline, depression, and dangerous daytime drowsiness. Many describe the sensation as living in a fog, physically drained, mentally hazy, and emotionally detached. Msr James, 74 years old, recounted, "I thought I was just getting old until I nearly caused an accident falling asleep at the wheel. That's when I realized if I don't get treated, I may not make it to 75. The truth is, all of these outcomes are preventable with timely diagnosis and treatment. And here's the good news: the path to recovery doesn't have to be complicated or overwhelming. Stay with us, because in the next part, we'll walk you through the most effective senior-friendly solutions that could transform your life. Effective treatment options for seniors. The good news is that obstructive sleep apnea (OSA) is completely treatable with science-backed methods that are safe and well-suited for older adults. The key is to get an accurate diagnosis and choose the treatment that fits your health condition and lifestyle. 1. CPAP machines. The gold standard. CPAP, continuous positive airway pressure devices, deliver gentle airflow to keep the airway open during sleep. This method is clinically proven to improve blood oxygen, enhance deep sleep, and reduce the risk of stroke and high blood pressure. Modern CPAP machines are quiet, compact, and user-friendly, even for people in their 70s and beyond. Millions of users report dramatic improvements in sleep and daily energy after consistent use. 2. Oral appliances. For mild to moderate cases, dentists may recommend a small mouthpiece worn at night that moves the lower jaw forward, preventing the tongue from blocking the airway. These appliances are non-invasive, simple to use, and ideal for seniors who are uncomfortable with machines. 3. Lifestyle adjustments. Losing weight if overweight, sleeping on your side, avoiding alcohol and sedatives can all reduce OSA severity. Breathing exercises, gentle yoga, or calming bedtime routines can also enhance sleep quality. Most importantly, don't guess, get tested. Diagnosis can now be done at home with no need for a hospital stay. Once you know your status, you'll be equipped to reclaim your sleep and your health. In the next section, we'll show you exactly how to get started with testing and which warning signs you should never ignore. When should you get tested, and what's the first step? Obstructive sleep apnea isn't always obvious. Some people don't snore or wake up during the night, yet their oxygen levels drop dangerously low without them knowing. That's why timely testing is the key to protecting your health. So, when should you start suspecting OSA? Number 1. You wake up tired or with headaches, despite sleeping enough. Number 2. Your spouse or family say you snore loudly or stop breathing at night. Number 3. You feel drowsy during the day, nodding off while watching TV or reading. Number 4. You're on blood pressure medication, but it's still uncontrolled. Number 5. You have atrial fibrillation, AFib, or unexplained rapid heartbeats. Number 6. You've gained weight quickly over the past 3 to 6 months. If you have 2 or more of these signs, don't wait. Get tested as soon as possible. How do you get tested? Nowadays, you can test right from home using a compact medical device prescribed by your doctor. There's no need to stay overnight in a hospital. The data is reviewed by a certified sleep specialist who can give you a precise diagnosis. What's the first step? Talk to your primary care doctor or a sleep specialist. Bring a list of symptoms and ask, should I be tested for sleep apnea? This one small step could protect your heart, your memory, and your long-term quality of life. Caring for your sleep is caring for yourself. Dear friend, after years of putting others first, your children, your family, perhaps now is the time to begin caring for yourself, starting with something as essential as sleep. Sleep apnea is not just an old age issue. It silently wears down your heart, clouds your memory, and drains your energy. You might think it's just part of aging, but there are things you can improve starting today. Maybe you've been hesitant testing sounds, inconvenient or unnecessary. But sleep testing is now much easier than before, and early detection means better outcomes for your health and well-being. If this video helped you, leave a comment below to share your story or ask a question. I read them all and use them to shape future videos. And if you haven't already, please click subscribe and turn on the notification bell so you won't miss any helpful updates. You deserve peaceful sleep and a graceful, healthy life in your golden years.